We're celebrating the 10th anniversary of the signing into law of the Family Smoking Prevention and Tobacco Control Act. We're celebrating the making of history in 2009, which gave powerful regulatory tools to the Food and Drug Administration to use the tools of product regulation to try to reduce the disease and death associated with tobacco use.
So the center was created by the Tobacco Control Act in 2009. And it was really a very exciting, challenging time because we were building a new FDA center from scratch. And in addition, no one had ever regulated these products before. So we had a lot of logistical issues. For example, where would we be? Where would our offices be? Where were we going to get computers and phones and pencils and pens and things like that? Also, we needed personnel. Fortunately, many people, including myself, were very attracted to the center because of its public health mission and had kind of personal reasons for wanting to join the center.
Within days of the president signing the new law, several of us were contacted by the commissioner's office to come together to do the early steps of creating a new center. We were all together in Building 51, I think it was the basement, and the first thing we did was print out the new law.
When I first came to CTP, there was good tobacco research going on. There has been for a long time. But there was very little integration. You had different researchers out there doing their own thing. One of the things I think we've been very successful in the Office of Science in doing is being a facilitator to get better integration across these researchers and to really, as a result, create this synergy around tobacco science that just didn't exist 10 years ago.
So when I first came here, I came directly from the advertising agency world. And, we had a really small team, and I knew that we needed to build a team of professionals that understood both the art and the science, because at its core, advertising is the perfect blend of art and science.
From an organization of one person to 800, you really have to become very nimble. An organization of 50 or 100 looks very different and operates very differently than an organization of 800.
There was this camaraderie amongst all of the group in which they were so dedicated to the public health mission of the center and knew what we were doing was so important for right now, but also for generations to come.
We're going to continue to grow. We have to continue to grow to meet the programmatic needs and demands that we have. And being able to manage the continued growth of the center is one of the challenges that we are facing, and I'm confident that we'll be able to be up to that task as well.
So dealing with the changes in the marketplace over the past 10 years has been a huge challenge, but I also think it presents an opportunity for us. As most people know, we've seen new products come out in the market, e-cigarettes or what's sometimes referred as vape products. The challenge has been understanding these new products, these novel products, and understand them fully enough to understand how to best regulate them.
We went through a rulemaking process to expand our authority over the original products that Congress said we could regulate. And the original grant was cigarettes and smokeless tobacco, basically. And we went through something called the deeming rulemaking, which took 2.5 years. And now we regulate every category of tobacco products that meets the definition of what is a tobacco product.
So this includes electronic cigarettes, cigars, pipes, hookah, anything that meets the definition, as well as things that might be created in the future that we haven't even thought about yet. And what deeming did was it made them subject to the requirements of the law. But one of the important things that it also did was now that FDA has jurisdiction over these products, we can establish requirements for them to help improve public health.
So the offices really do work together to make our announcements a success. One of the examples that really stands out to me is when we rolled out deeming. And in particular, there were volunteers from across all of the offices that served in a call center with us. They were the first line volunteers answering the phone to answer the questions from over 1,000 inquiries that were received in the first week.
We were able to hit the ground running when the rule began to go into effect. As we confront whatever the latest change in technology in the marketplace is, or the latest thing that's going on with kids' uptake of whatever the tobacco product is, we are up to the task as long as we are in the game and using the compliance tools, the research tools, the communications tools, and the policy tools. That's what we do, and we're good at it.
amazing how much we've accomplished. I mean, just the sheer volume of products we've had to deal with and the regulatory submissions like marketing applications and ingredient listings, inspections, that all of my staff in the Office of Science have been involved in. It's really remarkable. And to really understand these products and understand how to meet our public health mission, understand the products well enough and how we should regulate them to meet that mission, and to get where we've gotten in the past 10 years in that area is just, mind-blowing, quite frankly.
Last October, we had our 1 millionth inspection that was completed, and as a result of all the hard work, working collaboration with the states, we've issued tens of thousands of enforcement actions, including warning letters and civil money penalties, and over 150 no tobacco sale orders.
The first campaign that we got into market is called The Real Cost. And in the first 2 years that The Real Cost was in the market, we know through our evaluation that we had reached over 90% of kids effectively at least 15 times every quarter of the year. We know that we actively shaped and changed their attitudes and beliefs towards tobacco products. We know that the independent effect, or the real cost, was that nearly 350,000 kids who would have gone on to use tobacco if the real cost wasn't in market didn't. Those children have an opportunity to lead a healthier life. We've saved the nation over $31 billion, with a B, in future healthcare costs that have been diverted because of the real cost.
From award-winning public education campaigns to a compliance and enforcement program that's conducted over 1 million inspections of retailers, to a regulatory science program that is doing groundbreaking work with longitudinal studies following tens of thousands of children and adults, to policies through guidance and regulation that are going to be the envy of regulatory authorities all around the world if they had the same tools that we do.
What I have found most personally rewarding about my work here is that the opportunity to make a difference, to reduce the death and disease caused by tobacco, is so real. My father is a lifelong smoker. I grew up watching him struggle with the addiction of nicotine. I now have 2 young children, and having the opportunity to make that difference for the rest of America moving forward, and especially for my kids and their future, is very rewarding to me.
I think my staff stays super excited about it because the magnitude of impact that we can have in decreasing the number of Americans who die or suffer chronic disease from tobacco use is enormous. And for me personally, I have family members who have died from lung cancer. I have young children myself. I have nieces and nephews who are at that age where they might pick up tobacco products. And so to be able to have an impact on those people that I know personally is a huge opportunity that I'm extremely grateful for.
My mother smoked for over 40 years, and she died of lung cancer. My father never smoked, but lived with my mother all those years, and he died of lung cancer. Most of the people who came to the center at the very beginning, and I think many who still are coming to the center, do so because they are drawn to the public health mission of the center.
When we look across the board at all of the issues and all of the tools and the resources that we have, there's one thing that we keep on coming back to. It's not just that tobacco use is the leading cause of completely preventable disease and death in this country. It's that the primary contributor to that is cigarettes. And we have it within our regulatory reach to use regulatory tools and science to transform the cigarette as we know it by going through a rulemaking process to render cigarettes minimally or non-addictive. And we've done some modeling out through the end of the century to project what the population level impacts of that one policy would be. Many millions of lives would be saved from this one policy if we get it right.
Can you imagine if there were a world where nicotine-containing products were not addictive? I think that would be a huge public health win.
I mean, the hope is that we'll set policies that will really enable us to help adults find their off-ramp to leave cigarettes behind while preventing kids from taking an on-ramp. And that's the delicate balance that we face from a policy standpoint and from a public education standpoint.
It is so rewarding to see the passion and the commitment and the dedication of everybody in the center to the public health mission of what we are about, which is to do something about the leading cause of completely preventable disease and death in the country and in the world.